Welcome to the St. Philip's College annual Black History Month kickoff celebration. I am Dr. Sharon Crockett-Ray, Heritage Committee Chairman. To commemorate and celebrate the contributions to our nation made by people of African descent, American historian Carter G. Woodson proposed the establishment of Black History Week nearly a century ago. A week-long celebration would continue to be set aside to recognize the significant contributions of African Americans until 1976, when, as part of the nation's bicentennial, it was expanded to a month. Since then, the United States presidents have proclaimed February as National African American History Month. The theme for this year's observance is Black Health and Wellness. Under the dynamic leadership of Dr. Adena Williams Loston, president of St. Philip's College, she is committed to celebrating the rich cultures and legacies of our diverse communities. At this time, Dr. Loston will introduce our guest speaker for the St. Philip's College Black History Month celebration. I present to you Dr. Adena Williams Loston.
Welcome. Thank you for joining me in celebrating Black History Month. We have a lot to celebrate. There are many celebrations that are taking place. But here at St. Philip's College and Historically Black College, we celebrate the fact that for the past several weeks, HBCUs have been under siege and being terrorized by the fact of we've been experiencing bomb threats. However, now we can celebrate the fact that that dark part of our history is now over. The perpetrators have been caught, and even though this was a fun exercise for them, it did create fear and anxiety for those individuals that were a part of the academic experience and having it disrupted for the sake of joy. So we celebrate that that is now over. And we can move forward, thinking about all of the Black history, the Black heroines. And I'd also like for you to focus in on those folks that may not be as celebrated, but they're amongst your family members that they too have contributed to Black history. So let us focus on the well-known and then the unsung heroes. Today, it is my pleasure to introduce our speaker. He's in fact right down the street from us. It's my pleasure to introduce Dr. Kenneth Kemp, Senior Pastor of the Antioch Missionary Baptist Church of San Antonio, and a practicing pulmonologist and internist. A graduate of the University of Arkansas for Medical Sciences, Dr. Kemp is certified in internal medicine, pulmonary medicine, and critical care medicine. He is a fellow of the American College of Physicians and the American College of Chest Physicians. He is also an adjunct clinical professor of medicine of the Uniformed Services University and an adjunct associate professor of medicine, pulmonary, and critical care at the University of Texas Health Science Center at San Antonio. Dr. Kemp retired as a colonel from the Army Medical Corps in September 2009 after 25 years of service. He has served on numerous boards and commissions, including as the National Director of the Health Awareness Team of the National Baptist Convention of America, Incorporated International. Dr. Kemp is lead editor of Lessons for Life and the author of A Servant's Heart, and a cry during crisis. He is married to Velma Willoughby Kemp. They have two daughters, Jessica, who attended St. Philip's College. She is a staff minister at Antioch, and Joella, a pharmacist in Atascosa, Texas. Let us welcome Dr. Kemp.
To Dr. Loston, the faculty and staff, and students of St. Philip's College, it is a tremendous honor for me to have this opportunity to share with you today. I want to thank Dr. Sharon Crockett-Ray specifically for all of her assistance in this task and for the remarkable way she has extended herself to serve our community. I thank you for helping me out and being my friend. This honor of speaking to the wonderful people of St. Philip's College is very special to me, considering that St. Philip's is both a historically Black college and a Hispanic serving institution located right down the road from the Antioch Missionary Baptist Church, where I'm privileged to serve as senior pastor. I thank you so much for the invitation. During this Black History Month, our theme centers on health and wellness in the African American community. Now, this is a huge topic with hundreds of years of history and many layers of complexity. Don't worry now, I'm not going to try to cover it all, but I would like for just a few moments to say a few words about the history of health in the African American community and the challenges we face in our future. First, when you consider the history of health and wellness in the African American community, you have to conclude that African Americans are a resilient people who have overcome tremendous odds which were stacked against us in an almost insurmountable way. From the very beginning in 1619, when the first enslaved Africans arrived in colonial America in Jamestown, Virginia, African Americans have received substandard health care, if we receive any health care at all. In the ensuing years of the slave trade, countless numbers of African American men, women, and children captured along the western coast of Africa and cramped into slave ships died in the Middle Passage of the transatlantic slave trade. The millions of others who survived were brought to a land where they were treated no better than cattle or dogs. Their diet was unbalanced, heavy with fat, carbohydrates, lentils, and even lard, with very little protein, and a paucity of fresh fruits and vegetables. They received no preventive health interventions. They had no professional trainers or recreational workouts. Yet they worked relentlessly in the fields as field hands or on plantation homes as domestics, and they grew strong despite it all, and powerful and resilient. After slavery and Reconstruction came Jim Crow laws that worked to maintain the subjugation of African Americans in the South. Very few African Americans were involved in the delivery of health care at that time. Furthermore, healthcare facilities were often segregated, and those that were reserved for African Americans were often inferior. They were often inferior if they existed at all. An overt or sometimes unconscious bias against African Americans permeated healthcare. Unfortunately, that bias, to a certain extent, even exists today. Even worse than this, blatant and inhumane experimentation was performed upon African Americans. James Marion Sims, the white so-called father of gynecology, performed experimentation on enslaved African American women without consent or anesthesia in the late 19th century. The United States Public Health Service continued an investigation on the natural history of syphilis from 1932 to 1972, a period of 40 years, in the so-called Tuskegee study. when researchers of the government lied to some 399 poor black men and blatantly held back treatment even after the discovery in the 1940s that penicillin cured syphilis. Despite all of this, certain African Americans rose above the chaos to achieve remarkable feats in health and wellness. Dr. James McCune Smith from Manhattan in New York City became the first African American physician in the United States in 1837, though he had to go to Glasgow Medical School in Scotland to get his degree, since U.S. medical schools would not admit him. Dr. Daniel Hale Williams III was a pioneering surgeon in the late 19th century, becoming one of the first surgeons to perform open heart surgery in 1893 and opening the first integrated hospital in America, Providence Hospital in Chicago. He was a founding member of the National Medical Association, formed as an alternative to the American Medical Association, which at the time would not admit colored physicians. He was also a charter member of the American College of Surgeons. We could go on and on and on talking about African Americans who were pioneers in health and wellness, from Percy Julian to Charles Drew to Frank Bryant, who grew up right here in San Antonio. Time does not permit us to discuss them all. Suffice it to say that despite adverse odds, African American pioneers in health and wellness proved over and over again the intellect, the creativity, and the resilience of our people. Well, that is a whirlwind tour of the history of African Americans in health and wellness. We have to say something now about the challenges we currently face. Largely because of a legacy of oppression, limitations on healthcare accessibility, and challenges with regard to education and employment, there are still ongoing healthcare disparities in the African American community. For years, African Americans have been disproportionately affected by conditions such as hypertension, heart disease, stroke, diabetes, kidney disease, asthma severity, breast cancer deaths, and prostate cancer, just to name a few. African Americans make up a disproportionate number of new HIV cases and people living with HIV in the United States. There are different standards even for African Americans when it comes to kidney function and lung function. It is no wonder then that over the last 2 years, COVID-19 disproportionately affected African Americans because the pandemic served only to highlight the disparities that already existed. The Black folk were getting sicker in greater numbers for years before SARS-CoV-2 was ever thought about in Wuhan, China. Besides that, people delivering health care may harbor unrecognized or subconscious bias against African Americans. And African American patients may distrust healthcare providers and the healthcare system, often for legitimate reasons. What is worse is that there is a paucity of African Americans in healthcare. Just consider the numbers of African American stars in football and basketball that you can name without even having to think about it very hard. Now compare that to the number of African American leaders in healthcare that you can name right now. I imagine the leading athletes would outnumber the leading healthcare providers by a large margin. Dr. Louis Sullivan, who served as the Secretary of Health and Human Services from 1989 to 1993, an African American who was the founding president of Morehouse Medical School. Dr. Sullivan highlighted the fact that African Americans make up a scarcity of healthcare providers in the United States and linked that lack of diversity to decreased quality of care in our country. A subsequent Sullivan Commission in 2004 reported that while African Americans Hispanic Americans, and Native Americans, or American Indians, make up 25% of the U.S. population. They represented at that time only 9% of the nation's nurses, 6% of its physicians, and 5% of its dentists. More recently, the Association of American Medical Colleges reported that only 5% of active physicians identified as Black or African American, and only 5.8% identified as Hispanic. Thus, with these observations that have occurred over some 30 years, not much has changed in terms of the involvement of African Americans in healthcare delivery. Now, this is a serious problem because diversity in healthcare improves the overall quality of healthcare. Quite simply, people tend to have more trust and are more likely to follow the instructions if they receive healthcare from providers who look like them. Now, several agencies, such as the Association of American Medical Colleges and the Accreditation Council for Graduate Medical Education, have issued statements committing to diversity and inclusion in medical education and training. Well, to that I say, it's about time. Well, we've come a long way with some extremely remarkable individuals in our history. We've come a long way with improving, even to a slight degree, diversity in healthcare delivery. However, it is obvious that we have a very long way to go. Nevertheless, despite all of this, I'm encouraged about the possibilities of the future. I'm encouraged because of that indomitable resilience that is characteristic of our people. I'm confident because of the bright young minds that occupy St. Philip's College and other colleges and universities across this nation. I'm confident of it because of students like Gavin Wiltshire, a high school senior and a member of our church, who scored one of the highest scores in the nation on the SAT and has already determined that he's going into medicine. I am encouraged because we have been a people over nearly 403 years who have always risen to the challenge with remarkable resilience. Well, President Obama said it like this. He said, "Yes, we can." When others say, "No, you cannot." When others place barriers in your path, when others try to keep you from going to school, or keep you from earning a decent wage, keep you from living as men and women of dignity, and yes, when others try to keep us from voting, and they say, "No, you cannot," we say, "Yes, we can." We will walk through open doors. But listen, we will knock down closed doors if we have to, in order to achieve what God has placed upon our hearts and within our hands. Therefore, go forward, my friends, knowing your great history, cognizant of your current challenges, but never daunted in terms of your future and your potential. Know this: yes, we can.